Welcome to another edition of Eye on the Issues. And once again, we are talking about marijuana, the impact it has on people. Not everybody really understands what happens to people of all ages that smoke or use marijuana. Joining us today is Dr. Richard Wiggins. Doc, you've got obviously a lot of knowledge about this subject. Let's begin by asking how you got interested in learning more about marijuana.
Well, marijuana it's a very personal subject to me. It's something that I have three cousins who are all not with us today, unfortunately. And I have absolutely no doubt that they would be here today if not for marijuana. One of them died just a few years ago, and he had smoked marijuana heavily for about 30 years, died of a sudden heart attack. And then I have another young man who's a very close relative who went off to college, and he got in with a group of guys who were smoking marijuana, and he saw that they seemed to be doing okay. And so he started smoking it with them. But after only about 2 or 3 times, he had a very significant psychosis, paranoid delusions. He thought people were chasing him. And so he wound up in a psychiatric hospital. And unfortunately, he was never able to return to college. And that's the personal side. Then the professional side, I see most of my patients who check that they use marijuana. When I talk with them or when I read their health history, there's significant anxiety there. Also, when I do sedations, I do a lot of sedations. And when I do sedations, we have to use about 2 to 3 times more propofol to keep these patients asleep. And then lastly, after surgery, there's about a 60% increase in the need for postoperative pain medications. And that's not just me saying that. That's the American Society of Anesthesiologists saying that. And so when I saw the personal side and the professional side, saw the effects, the harmful effects of marijuana on my patients, my family, my friends, I began to look into this subject, and what I found really shocked me.
So for people that don't know, tell us what kind of doctor you are.
I'm an oral and maxillofacial surgeon. I'm kind of the bridge between medicine and dentistry. And so a lot of people think of oral surgeons or oral and maxillofacial surgeons as being people who extract wisdom teeth, but we do a lot more than that. We do more outpatient sedations than anyone. And we also do a lot of pathology. So cysts and tumors in the jaws and on the face, a lot of infections, and a lot of reconstructive type surgeries.
Understood. Now let's dive back into marijuana for a second. Do we have any idea how many Americans actually use marijuana? We know it's becoming more and more legal in many states.
It depends on the statistics that you want to look at. It ranges anywhere from about 20 to 30% of people use marijuana each year. As many as 46% of those who are in their late teens to 20s, college age to late 20s, 31% of 12th graders, and even 8% of, 10% of 8th graders use as well. So unfortunately, a lot of people are using, and that number is way up from 20 years ago.
Yeah, and the sad part about this is I think some people hear that, oh, it's legal, it must be okay. It's not only legal medicinally, it's legal recreationally. But reality is today's marijuana is not the marijuana of 30 or 40 years ago. Can you explain the difference?
Oh, absolutely. If you go back to 1969 to Woodstock, the THC percent, that the THC is what causes the high. And when you're talking about THC percent, you're talking about potency. And the potency of marijuana in 1969 was 1 to 2% on average. And if you got the really good stuff, that was 3%. You fast forward to 1995, and it's about 4 times that. Well, today it's 23% on average, and you can get some marijuana that's pushing 40% at this point. And if you get some other types, some of the oils and things like that, you can get over 90% THC. And anytime you get over about 10%, that's considered high potency, and that's going to cause a lot more problems. It causes more addiction. The high potency marijuana is about 4 times more addictive, and it causes increased problems with physical health, with mental health, violence. There's a lot of problems that the high potency marijuana's cause.
So, knowing what you know, what goes through your mind when you hear more and more states are legalizing marijuana?
Well, it's really sad to me because it's based not on science. It's based on popular opinion, and wherever we see marijuana legalized, people think that means, well, it must be safe. If we're legalizing it, it must be safe. But unfortunately, that's just not true. As I said, there's a lot of dangers, and so we see increased car accidents, increased death in car accidents. We see a lot more violence, and we also see a lot more of the mental health issues, suicides, and a lot of physical health issues, problems with the brain, the heart, the lungs, etc.
And so, what actually does marijuana do to the brain?
Well, it causes a lot of problems. If you're talking long term, there's a couple of big studies that talk about the IQ with marijuana, and there's one study that shows that there's an 8-point drop in your IQ over a couple of decades. There's another one that shows a 5-point drop, but let's say it's an 8-point drop. You're below 71% of your peers if that really happens, and I believe it does. There's a whole lot of problems with memory. There's problems with strokes. People don't realize that marijuana causes strokes. There's a 41% increase in a certain type of stroke called an acute ischemic stroke, and that's the most common type of stroke. But there's a 41% increase in that in young people who use marijuana. And then all of the different problems that you have with higher functioning portions of your brain. There's a lot of problems with that when you use marijuana. People think of it as just something that's really short term. Everybody understands that for a few hours there's going to be issues with the brain, but what people don't understand is that there's long-term issues, and these issues, unfortunately, studies are showing now that these issues are likely permanent.
That is very disturbing. Now, in the last couple of weeks, the American Heart Association had a meeting, and a presentation was made there about the effects of marijuana on the heart. Can you tell us a little bit of, not about the study, but about what you know about how it impacts the heart?
Yeah, that was probably the biggest thing that I found. As a doctor, I did not realize that that all of the problems that marijuana causes on the heart. But it causes devastating effects. It causes a decrease in the oxygen in the blood. It causes increased carbon monoxide. It causes increased inflammation. It causes an increase in blood pressure of somewhere between 20 to 100%, and an increase in heart rate, the same. And these put a tremendous stress on the heart. And it does this for at least 2 to 3 hours after smoking marijuana. And so long term, there's a lot of increased risk of heart attack. In fact, the first hour after smoking marijuana, there's a 5 times risk of a heart attack. That was one of the statistics that absolutely blew me away. I didn't understand that. For a couple of hours, there's a 2 times risk. There's a study from Canada that shows that for young people who smoke marijuana that are 18 to 44 years old, when they smoke marijuana for 30 days, there's a 63% increase in heart attacks. There's another study from a major medical school that shows that there's a 2.5 times risk of a heart attack overall for everyone who smokes marijuana. And then a big study that another one that kind of shocked me, for people who have angina, that's chest pain, angina with exertion or chest pain when they're exercising. They would take people and they put them on a treadmill and they let them exercise, and they saw how long it took for them to have chest pain. Then they would wait a few days and they would let them smoke one joint. Now, these are all people who had never smoked marijuana before, but they let them smoke one marijuana cigarette. And on average, they had chest pain 50% faster than when they hadn't smoked the marijuana. So, I could just go on and on. There are so many studies about the heart, hundreds and hundreds of them that are out there that show the devastating effects of marijuana. It's really something that most doctors don't even realize.
Yeah, and people really, really need to know this stuff, especially states like Wyoming, where it's not legal and hopefully never becomes legal. Let's talk for a second, if we can, about the mental health impact of marijuana for everything from, schizophrenia, depression, suicide, bipolar disorder. Can you talk a little bit about those?
Yeah, absolutely. That's another thing that, as a doctor, that I didn't realize until this close family member wound up in a psychiatric hospital. But there's a great increased risk of anxiety. And, I had seen it in my patients, but I really didn't put it together until these issues with my family. But when you really look at the studies, there's somewhere between a 25 to 50% increase in anxiety for people who use marijuana. There's increased bipolar disorder. There's a huge study that just came out, and it was the first study that showed a causal relationship between marijuana and bipolar disorder. It's somewhere, depending on a whole lot of different factors, but somewhere between 2.5 to 4 times more likely to have bipolar disorder if you use marijuana. And that was a study that was done in 6.5 million people, and it was published in the Journal of the American Medical Association Psychiatry. If you're talking about panic attacks, there's a great increased risk of panic attacks. And then you talk about depression and suicide. Depression, depending on how early you start, how often you use, et cetera, somewhere between about a 37% to 100% increase in depression. There's a 50% increase in the risk of thinking about suicide. But for young people, there's somewhere between a 3.5 to 7 times risk of actually attempting suicide. And so if you think about this, they're only thinking about suicide 50% more, but they're actually attempting it somewhere between 3.5 times to 7 times more. So there's something about marijuana that makes attempting suicide much easier. And unfortunately, the number one drug that's found in toxicology screens among young people who have committed suicide is marijuana.
Wow, it's almost unbelievable. I wish it was not true, but unfortunately it is. And we're hearing more and more in the news business about marijuana grow houses, especially marijuana grow houses across the country in states as far away as Maine, Oklahoma, and this involves, in many cases, it involves international growers like Chinese. Have you heard much about that?
Yeah, absolutely. There's a lot of organized crime, and a lot of this apparently is it involves Chinese backers, Russian backers, Ukrainian backers, and a lot of the people who work for these organizations are people who are undocumented, and they're really basically slaves. And a lot of these organizations, they're fronted as if they're growing legal marijuana, but really what they do is where they make most of their money is the illegal market, because it's still much more lucrative.
And people hear about marijuana. I think most people don't think it's addictive like cigarettes are addictive, but is it?
It's absolutely addictive. And it depends on the studies that you want to look at. But I think the best studies show that there's about a 30% rate of addiction. You can find studies as low as about 9%. You can find studies as high as 50%. But I think the best studies, again, show about a 30% rate of addiction, and that's called cannabis use disorder. And if you're talking about young people, there is a study out, and most of the studies show a little bit less than this, but there's a study out that shows a 46% rate of cannabis use disorder in those 12 to 17 years old. Most of the studies are going to be more in the 30% range for that age, but whatever it is, that's a lot. And the problem is that you never know if you're going to be the person that becomes addicted. So you're playing Russian roulette when you start using marijuana.
What about pregnant women? What do they need to know about the possibility if they choose to smoke marijuana during their pregnancy?
There are tremendous problems to the brain. There's problems later on that we're finding that people who were in utero and their mom smoked marijuana, that there are tremendous problems with basically every aspect of thinking, memory, ADHD. There's a lot of problems. And in fact, there's some new studies out now that are talking about epigenetics. And epigenetics are something that control our genetics. They control our DNA. And they're finding that people that even started before they were pregnant, in other words, people that were in their teens, young men and young ladies are passing on genetic problems to their children. And it can even happen down to the fourth generation, according to Dr. Stuart Rees from Australia.
Wow. And so what would you say to the people, lots of folks that are going to watch this are in the state of Wyoming. Wyoming has not legalized marijuana at this point. I'm sure there's going to be a push every legislative cycle to make it happen. What would you say to the people of marijuana, the lawmakers and the citizens that are going to watch this?
Well, don't buy into the lie that it's going to help your state. A lot of times lawmakers will buy into it because they think it's going to help their state budget. But if you look at the state just south of you, Colorado, only about 0.85% of Colorado's budget is from marijuana sales. And the problem is that for every dollar that Colorado brings in, $4.5 is spent to mitigate the problems that it causes. And most of that is increased healthcare costs to the state. And from the standpoint of human tragedy, you're really bringing a lot more tragedy. All of the suicide and the crime, and then all of the mental health issues and the physical health issues, the suicides, et cetera. So you're bringing all these things onto people, and because there's a lot more use. Anytime that marijuana is legalized, despite what advocates of legalization will tell you, there's a lot more use, and it depends on the statistics that you want to look at. But for young people, it's about a 25% increase. And so there's also a doubling of domestic violence, according to one study. So a lot of problems that you're bringing into your state, and you can save yourself and the people of your state a lot of problems if you won't legalize it.
Now, you've got an upcoming book, Weeding Out the Lies About Marijuana. Tell us about that.
It's actually changed to Weeding Out the Myths About Marijuana at this point. But it's a book that's going to talk about both the medical and the spiritual side of marijuana. There's actually going to be two books. One will be strictly the medical side, and that is so that I can get it into public schools, et cetera. But it's going to talk about the physical health issues, the mental health issues, all of the violence, et cetera, which again, I didn't understand that until I started studying this. And people will tell you that there's not more violence, but there really is. And then it talks about the spiritual side of things as well. And when you look at that, you don't realize that the Bible really talks a lot about being sober, and it gives actually 9 reasons for us to be sober. So that's what the book is about. And then there's going to be study guides as well.
Nice. And so is there a website, or where can people go to find out more about you and what you do?
drwiggins.com, drwiggins.com. And just click on connect there and connect with me. Let me know where you heard about me, and then connect with me on social media as well. That would be greatly appreciated. And I'll keep you up to date. And if you'll connect with me there, you'll get a discount on the books when they come out. And that's going to be sometime in early 2024.
Great, Doc. We really appreciate everything you brought to us. And this is such important information for Americans of every age to know about, because what marijuana is doing to this country is just a travesty.
It really is. I couldn't agree with you more. Thanks for having me.
You bet. So this was brought to you by the Wyoming Liberty Group. You want to find out more about what's happening around Wyoming, go to wyliberty.org and sign up for the mailing list. Thanks, Doc.
Thank you so much.